Hey guys, John Adamson, the Rehab and Documentation Guru, and today we're going to be going over a response to an article that I found in The Humanist. This is an online magazine. It is obviously from a humanist perspective, and it's obviously right in line with the topic that we've been talking about a lot lately. And the article is entitled Why We Should End Religious Exemptions for Vaccines. And this came out just on the 24th of August of this year by Kate, and I'm not going to try to say her last name because I'll probably butcher it, but she is a contributing author for The Humanist. And so what I'm going to do is go through the article step by step, and I'm going to answer not all points. And I avoided a little bit of the start of the article because it was just getting into like a little bit of the history of religious exemptions. But for the full article, I do include the full title here for you, the author. You'll be able to easily find it if you go to thehumanist.com. So with that said, let's get into the article. So I decided to go step by step through this article. And like I said, I skipped a little bit of the intro about the history of religious exemptions. But pretty much from here on, I'm going word for word through the article. And not all the points that she's bringing up in the article are direct uh, points that she's making against vaccine mandates. But I wanted to talk a little bit about some of the points she brings up. So this article starts, in July, the director of the Centers for Disease Control and Prevention warned that we are entering a pandemic of the unvaccinated. And there was a recent study that was done that's been cited by the CDC, although, and this study was done in July, but the problem is that we still haven't had the data published. I've been searching today, throughout the day, different points, high and low, to find this actual data, but all we have is reports by individuals from the CDC. And now there is some troubling data for those that are on the pro-vaccine side that the spread of the virus itself may be equal from unvaccinated as it is from vaccinated. There are some that are contending because viral loads are found, like for example, in the nasal cavities of vaccinated people who catch the disease, the viral loads are at least equal to those of unvaccinated, that the contention is, well, therefore the spread can be equal since it is an airborne disease. So there is that troubling concern. But one of the things that has been cited, has been stated, but we don't have the data to support this, is that the unvaccinated are 11 times more likely to die. And you've heard this statistic said over and over again. But here's something to keep in mind. The survival rate for the vast majority of people, whether they're unvaccinated or vaccinated, and this was even before the Delta variant came, was anywhere from like 99.9 to 99.8% survival rate from the COVID disease. And obviously the data doesn't look as good once you get further in age and comorbidities. So for example, the one group that really struggles with it is going to be the over 65. And once you get into that data range, now you're starting to look at mortality rates of around 10 to 11%. But you're also seeing that the average comorbidities, meaning diseases that are concurrent with death by COVID, is hovering around 4 separate comorbidities on average. So we're still seeing this as being a disease that can take your life, but mostly if you have a lot of complicating medical factors. Now, every one of us probably knows at this point because, it's been around for a while and it has been devastating. We probably know somebody that didn't necessarily have 4 comorbidities who died. I'm thinking of somebody that was just barely 60, who I think was overall generally healthy, who did pass away from COVID disease. But then I have a friend of mine I think he's nearly 60, who's been in the hospital for a long time with a pancreatic disorder, very sickly, got COVID while he was in the hospital and made it out of that. Just because you have comorbidities and complexities doesn't mean you're going to necessarily die. So what's troubling about this stat is that we just don't have the data. CDC has not been forthcoming. They have said that they will share the data. They have not, and they've had this data supposedly since July. So we can say that this statement may be a little suspect. So the author goes on to say, only about half of the US population is currently vaccinated. And although that number has been growing in the past weeks, it is not rising fast enough. So the question is, what is fast enough? I'm guessing she would like everything done tomorrow. Everybody vaccinated, that would be fast enough. So statements like that need to be a little bit qualified. This slow vaccination rate, coupled with the highly contagious Delta variant, is causing COVID-19 cases to grow while reducing the amount of hospital space and resources across the country. So let me talk to you as a healthcare practitioner who has insight and inside knowledge about what's been going on. One of the problems is the vast problems with staffing for nursing. I'll give you an example. So I went to Indeed.com and just using the search word nurse. On Indeed.com, within the United States, you can see there how many jobs there are available. 425,761 jobs with the title nurse. Now, not all those nurse jobs are going to be hospital, obviously. Some of them are nurse managers, some of them are nurse reviewers. So these aren't all practicing nurses that are going to be in hospitals or ICUs. However, it gives you an idea just how bad the availability of nurses is right now. And in fact, I can't tell you, but I can tell you something. The majority of nurses that I know would love to do things like nurse review and nurse management. And get out of the field a little bit, especially if they've been in the field for a little while. The fact that there are so many listings for those kinds of jobs that are going unfilled is problematic. Also, as far as nurses go, a lot of them depend, even in the hospital setting, on CNAs to provide some care. Not so much in the ICU, because generally you're going to have the nurse being a little bit more intensely involved in the care of the patient. But look at the CNA job openings right now. So those are humongous numbers, and it gives you a sense of just how bad the supply of workers are. And one of the things that hospitals will have to do is they'll close down beds or rooms when they don't have enough staff. There are certain levels of nursing that must be provided. So, for example, a nurse can only have so many patients in a given setting. So in the ICU, I remember my son was in the pediatric ICU for 5.5 months, and it was unusual for a nurse there to have more than 2 patients. I mean, occasionally you might have one that had a third patient, and that's if they were just in the ICU because their monitoring needs were on the high side, but they were pretty stable. But like when my son was gravely ill, he had a dedicated nurse just for him to be monitoring him every minute of her shift that she was there. So that tells you something, that when you have that many nursing jobs available and there's a nursing shortage, the fact that we have unavailable beds that supposedly we're filling up in the ICU, in large part is due to the lack of nurses. And one thing to keep in mind is that when COVID hit, it devastated the healthcare workforce. Here's an article from NPR. NPR, not exactly a news agency that's friendly to conservatives at all, but NPR back in May of 2020 said, Amid pandemic, hospitals lay off 1.4 million workers, and that was in April and last year. Uh, so, the beds are physically present in a lot of hospitals. Not all, not all. My daughter was pointing out one of the hospitals that she does affiliation at for nursing. They the architect, for whatever reason, when they were building um, the hospital off the blueprints, did not adequately design for the ICU. There wasn't enough ICU beds, and so it was kind of an afterthought. But for the most part, a lot of hospitals just don't have the workers. The week before my hospital system announced that they were going to be requiring vaccine mandates for healthcare workers, the week before, they sent out a memo that they had like 700 and something available jobs and asking people to please like canvass their friends and find out if they'd like a job with our hospital system. That's how bad it is. And part of it is the workforce in healthcare is not recovered from the massive layoffs. And why were they laid off? Some people might wonder, why during the middle of a pandemic were they laid off? Because so much of that support staff was for other types of procedures besides emergent or acute care. So you had people going in for surgeries of various kinds. And when the pandemic hit, a lot of those surgeries were put on hold. Offices were closed, and when they didn't have the hours or the patients coming in, the billing was down. They laid off massive amounts of workers, and there are a lot of people that are saying we're not recovered from that yet. So while yes, COVID is increasing healthcare need, the hospital space and resources is vastly impacted by the letting go of these people. And guess what? Some of these hospital systems are still letting people go because they don't want to get the vaccine. It's crazy, I know. Now, one of the problems I have with this article is that it relies on a lot of secondary and sometimes tertiary sources. So, in research or even like in investigation, like investigative journalism, primary source is really important. Like if you can go right to the data itself, like the CDC data that I was saying is lacking, that would be the most ideal way to verify the accuracy of what the CDC heads are telling us. But what happened in this particular article, and they were good enough to provide links to the articles they used. Um, a lot of these were secondary sources, and there was one instance where I clicked on the link in the article and it brought me to another news article, and I clicked on that link and it brought me to another news article. In one instance, I clicked on the link and it brought me to an article which I clicked on the link and it brought me to the same article again. So that's called circular reasoning, um, when you're just validating yourself. Anyway, let's continue reading here. And although the Delta variant can still infect those who have received the vaccine, it is estimated. So you got a question. Okay, it's estimated. What does that mean? Estimated. It'd be a really good idea to have actual fact. It is estimated that 98 to 99% of recent COVID-related deaths are among those who are unvaccinated. So is that true? So going back to what the CDC data said, that you're 11 times more like, and this is just somebody reporting this data, you're 11 times more likely to die if you're unvaccinated. So this data that's being cited here is in conflict with the CDC data that I just talked about. But it says it's estimated that 98 to 99% of recent COVID-related deaths are among those who are unvaccinated. And what's their source? NBC News. So the article cited here is NBC News. A former Biden advisor on COVID estimated that 98 to 99% are amongst the unvaccinated. So anyway, how valid is that data, and how much can we trust a partisan advisor? to give us fact. So one thing you'll notice in every one of these slides, the article is in black and then blue hyperlink, and then my notes are generally in red. So for example, okay, so she starts off by saying, it is clear, at least for now. So when she says that, at least for now, it seems like she's willing to at least concede that it might not be so clear in the future what she's about to say. It is clear, at least for now, that readily available COVID vaccines are our best move forward. So here's an ethicist who's a humanist. She's writing from an ethical perspective as a humanist. So it is clear, at least from now, and she's basing that on the data, which, like I've said, hasn't been substantiated, that it's best to move forward with the vaccines. So she can't validate that entirely. And as we've seen, and I'm going to point this out, studies are showing that that data isn't as good as it used to be. So anyway, she says about the vaccines, they're proven to be effective against the virus. But one of the things that we've seen in recent studies is, and Pfizer and Moderna have had to verify this, that there's waning effectiveness. In fact, some of the CDC data seems to suggest that, and this was a study based out of Israel, that they were seeing waning efficacy of the Moderna vaccine from the high 90s for preventative of the disease to about the low 70s, and the Pfizer vaccine from the 90s down to the 40s. I think it was like 43%. So there are huge drop-offs. And one of the things that Israel is doing is not only have they started rolling out third shots for Pfizer, but they're talking about a fourth shot. And some are even admitting that this could be an ongoing thing. And Pfizer right now is developing in conjunction with their vaccines a twice-a-day pill to be taken. Where does it end? Where does it end? Okay, let's continue. Okay, they're proven to be effective against the virus, and even with slightly going from the 90s to the 40s, at least as one study is showing, slightly diminished efficacy against the Delta variant, they still protect against hospitalization. And this does appear to be true. We can dispute whether the data is as good as they say. So that same study that they have not provided us the data for, they're saying that it's a tenfold reduction in hospitalization if you get vaccinated. And so we can't validate that, but it is likely that it is reducing how much hospitalization occurs for those that choose to get the vaccine. So there's the citation. When you click on that hyperlink on the article online, protect against hospitalization. Actually, that might be my citation of the actual data. So anyway, I can't remember, but check that out. Okay, and then she goes on to say, it will be vital to encourage communities to get vaccinated if we ever want the chance to beat this pandemic. Now, this is kind of a denial of current thought on this, and that's why I said conjecture, because one of the things that's very clear, has become clear, is we're never going to eliminate COVID. COVID is a novel coronavirus, but coronaviruses stay around and they mutate and they come back every year. And so you've got more and more experts in immunology are admitting that, yeah, it's going to be around. We're just going to have to deal with it. It's going to come back. And so we're not going to ever beat it, so to speak. But, once our bodies get used to it, after a while, it's no longer novel, right? And just like any new virus that comes around, After a while, we get used to it, and it's no longer a novel infection, and our bodies have developed antibodies to it and the blueprints for making new antibodies when we're challenged with that virus yet again. She goes on to say, however, there are still large groups of people who are hesitant or in outright opposition to receiving the vaccine, and their reasons vary across the country. I do appreciate that about this author, is that she's making it clear that people have differing values, views, reasons behind why they don't want the vaccine. And some truly are hesitant. But one of the problems I've seen in news reporting is they've used this vaccine hesitancy statement as though that describes everybody. And that seems to suggest that if people would just get a little more education, they would then be okay with it. And we just got to keep pumping them full of information. But there are some that, like myself, that are outright opposed to it for different reasons, and I've enumerated those before. So at least she's honest that you can't pigeonhole people. It says some communities have very valid reasons for not receiving the vaccine, from medical exemptions to lack of accessibility. Okay, so she's going to get into that, but so medical exemptions, obviously there are people that shouldn't take it. So people that have, they've suggested that high levels of food allergies. My daughter has high levels of food allergies. People that have had a history of Guillain-Barré. They used to say pregnancy, but now they're not so much anymore. They used to have caution about certain age groups, and so anyway, a lot of those they've eliminated, but there are some that have true medical exemptions. So she's saying those are valid, and I would agree they're valid. But then she says lack of accessibility. So where is this lack of accessibility? I travel between like rural settings to urban settings in my job and doing errands and stuff like that. And everywhere, and I mean everywhere, there are COVID stations. There are, a lot of the pharmacies are providing COVID vaccines. I've seen hospitals. I mean, I'm sorry. Hospitals do mobile clinics. I've seen, like outside booths, outside grocery stores. I mean, they're literally everywhere. So there's really no excuse. Now it does say marginalized. So marginalized peoples. What do they mean? They mean like ethnic diverse people. So what did they cite in this particular case? A New York Times article. Not a primary source, and the New York Times article, in order to read it, you have to be a New York Times subscriber. So I couldn't like review the article itself to validate what this young lady is saying. It goes back to the importance of primary sourcing. And then what about disabled? Here was her reference. A study in Detroit by the DDP, I'm guessing it's their disability services, of 34 residents in 12 counties. So that was their study that supposedly validates her point. That's pretty thin evidence, I must say. So, in general, we do know that ethnically diverse people, especially if they don't have English as a primary language, can experience some challenges getting healthcare. We do know in general that people with disabilities can experience challenges in getting adequate healthcare. And I've witnessed that, so I understand that. But you do need a little bit better data to support these statements in the COVID vaccination, because frankly, I have never seen in 30 years of healthcare the drive to get the shot to people or get a medical intervention to people like I've seen with the COVID vaccine shots. It's been crazy. She goes on to say, however, others have been become susceptible to misinterpreted vaccine data. So let's talk about vaccine data for a minute. So of course she's probably talking about VAERS, and there's been a lot of studies on VAERS that have shown that the data is useful. It's also underreported. And if you actually do read some of the reports, and I did, I downloaded the database on and drilled down to deaths by COVID vaccine. Some of the reports were clearly not reports of death by the vaccine. In fact, some of them weren't even reports of death, but they were showing up in the death category. But then there were true, very, very clear reports of death caused by vaccine. Patient received first shot of Moderna at 1230 hours. At 1242 hours, experienced diaphoresis, erratic heart rate, coughing, became cyanotic, and within like so many minutes expired. So there are cases like that. And so how do you misinterpret that cause effect, especially when you have some of these, they'll state patient had no known prior medical history. So these were sometimes generally healthy people. So we do have cases like that. And the fact of the matter is, death reports by vaccine are drastically up this year. And the main common denominator, the only change, the only variable, has been the mass COVID vaccinations. So anyway, that is concerning. But let's move on. And even conspiracy theories such as microchipping. Okay, that's on the loony side. I was reading an article by this guy who is, he does microchipping. That's his job. He designs microchips, some for like biomedical application. And he was pointing out how impossible it is to inject sufficient microchips to program people. And so, I appreciated what he was having to say. So yeah, that sounds like the loony side. There was even people that were saying that the shots were making them magnetic. I don't know. Okay, and the altering of people's DNA. Now, a lot of scientists have said, look, when you have messenger RNA, you don't alter DNA. It's very fragile. Once it does its replication to build the proteins, the antibodies, it falls apart. It just disintegrates. It's destroyed. And also the fact that the shots are going into extracellular space, not intracellular. So they're not even going into the area where the DNA will be. So I get that, but there is this one study which is kind of interesting, where cancer.gov, they talk about how there's a possibility of doing a novel mRNA modification that they can get the cancer cells to express themselves genetically differently. So some people are saying, okay, that is evidence that the mRNA can change things. So that that's a little bit concerning. But from what I've read, there's a difference between modified RNA and messenger RNA. And I would leave that up to you to look more into that. So it's iffy whether that can happen. But there are some people that are truly concerned that the mRNA technology in Pfizer and Moderna is causing problems. Okay, let's move on. These sort of theories have become talking points of the far right, who attempt to sow distrust in our government as they fight against vaccine and mask mandates and further politicize this virus. So what are the assumptions being made in that statement? That the far right, and I would encourage you, whenever you see somebody by the news labeled as far right, do a little investigation of that person for yourself and hear that person out for yourself and see if they sound like off the wall, far right, ultra they would say fascist, but you know what fascism was? You think about Nazism, it was really a far left ideology. And when you had Nazism fighting against communism, you basically had two far left ideologies, just a different practice fighting against each other. But I digress. So, what do they mean by far right? Can you better define that? Um, and does that mean that only these far right people don't trust the government? What about anarchists? They are far from far right. They don't trust the government. They don't trust either side, for that matter. Um, and then there's some that are featured as far right, like Ben Shapiro, for example, um, of the Daily Wire. He's featured as a far right guy. And yet, if you listen to him, he's clearly pro-vaccine. He's advocated strongly that people get the vaccine, and he's pro-mask. He's just not pro people being forced, mandated. So anyway, you, this is a broad brush by this author of those that have concerns or have maybe misinterpreted data or whatever. But some of us do have concerns about the vaccine data, safety, and effectiveness, especially when the CDC is not forthcoming with some of that data. Some of us, though, don't believe in microchipping. Some of us do understand that there is technology being developed. Look up CRISPR, CRISPR technology. If you can find a relative layperson's description of that, that's a little bit concerning. So there are definitely efforts being made to selectively edit genes with minimalistic effort, or I should say minimalistic trauma, which could come in the form of a shot, an introduction of a substance that would do the work for you. So it doesn't take somebody who's far right to have those concerns, however. Okay, what else did I say? Are those who are anti-COVID vaccine anti-vax? And, a lot of people have gotten vaccines. I've gotten vaccines. I will get the flu vaccine because I know that the flu vaccine can be produced synthetically. And in fact, most of the flu vaccines now are synthetic. And, So anyway, I'm not necessarily anti-vax. Are they anti-mask? No, I'm not anti-mask. Just because I don't want the vaccine doesn't mean I'm not going to judiciously, I'm botching that word, wear a mask once in a while. Are they really the ones that are politicizing this? And I would say no. They just want to be left alone. They just want to say, look, it's my choice to take the vaccine or not. Just leave me alone. They're not the ones that are making it political. Joe Biden made it very political last Thursday when he said, we're going to do all these other mandates. We're going to force you to get it done, basically. Is there any reason a sane person might distrust the government? With power comes corruption. With ultimate power comes I'm messing up. I'm tired, guys. I'm messing up the quote. But anyway, the more power invested in an entity, the more likely for corruption. All right, it advanced my slide, and I did not mean to do that, but why not? It says, luckily, she said, luckily, states are starting to recognize the importance of getting their populations vaccinated, especially in relationship to the opening up of their economies. More states are now implementing vaccine mandates, and while this is a step in the right direction, there is still a way for anti-vaxxers and conspiracy theorists to slip through the cracks. Religious exemptions. So is it that we're trying to slip through the cracks? Like, am I an avowed anti-vaxxer? No, I'm against these current vaccines for specific reasons. And I have certain religious concerns. I'm not trying to slip through the crack. I'm just trying to exercise my conscientious right to religious expression. Um, so anyway, you can see my point in red. Okay, let's continue reading. Religious exemptions for school immunizations have been around for quite some time. Okay, she just states facts here for the most part, but what is concerning, and I'm going to point out a graph here. She says this, in 2018 and 2019, we saw measles outbreaks across the country, sickening 1,000 Americans in 28 states. She's actually a little bit short of the actual data, resulting in New York becoming the fifth state to close religious exemptions for vaccinations. And I think Connecticut just became the sixth state, actually. So anyway, I went to this site here, and I'm going to show you the data from that. So here's the data on number of measles cases reported by year. Now I have some thoughts on this. See if I sound like I'm making some sense. But you will notice, unfortunately, my picture is blocked. Well, no, it's not. It's not blocking the graph. So you look at the years from 2010 to 2020, and you can see like a spike in 2014, which she didn't mention, and it is a pretty good spike in number of cases, and then it drops dramatically. What's that all about? That's kind of interesting. And then we're low, and then starts to build, builds in 2018, then really jumps in 2019, and then plummets in 2020. So a couple thoughts on that. Number one, we know that about April-ish of 2020, we started to see people wearing masks. Although at that point, Anthony Fauci was still saying, why are you wearing masks? You don't need to wear masks. You know, advocating kind of against masks. But then you did start to see closings of schools related to the pandemic until they found out that maybe children weren't the spreaders at that point with the original variant. So it could be that the vast increase in homeschooling during 2020 decreased measles at the time. I don't know if I said measles already on the previous slide. It could be that, but it could be also that this reporting in 2019 is somewhat of an aberration. Could it be that those weren't actually confirmed measles cases? Was it over-reported? Was it inaccurately reported? What's going on here? It really, even in light of getting, masks and starting to pull people out of school, this doesn't make that much sense. Having a 100-fold decrease in 1 year, that doesn't make much sense, especially if she's trying to pin anti-vaccination on the creeping up of these cases. And some have indicated that when you do have outbreaks, like let's say for measles, that the vaccine itself may have been the culprit. I don't know enough about that to say for sure, but I've read concerns related to that in different journals I've read. But this is what she cites, and I'm a little concerned that she didn't really look at the data. Should have warned you guys, this is going to be a long video. But let's keep on reading. And it's only getting trickier. As vaccine mandates expand to whole cities, not limited to just schools or government offices, we're seeing growing confusion among employees and employers, especially in the private sector. Following guidance from the Equal Employment Opportunity Commission, many businesses that are instituting a vaccine mandate are allowing for religious objections. Well, that's according to the EEOC, that's their right. And the reason I know that is I've had to get involved with looking at EEOC guidelines quite a bit lately, not only for my exemption, but I was looking at it related to how does it apply to like those that are in school, and there seems to be a general consensus that yes, it does apply to those who are students even, and so I don't see a problem with this. Following guidance, many businesses are that are instituting a vaccine mandate are allowing for religious objections. Truth. However, there is no standard practice for evaluating or granting religious exemptions, making it difficult for businesses to assess the validity of such claims. Okay, I have a problem with that statement. First of all, in healthcare, very simple, healthcare rights, patient's right to refuse. If a Jehovah's Witness walks into an emergency room and they are anemic because let's say they've lost blood and they need blood, they're having problems associated with blood loss. Their anemia is causing problems. I say to them, let me give you some blood. They say, no, I'm a Jehovah's Witness. That's it. I don't make them go, okay, can you tell me what the Jehovah's Witnesses say about blood products, and where do you find that in the Bible? Can we get the elders of your church to validate that you are a practicing Jehovah's Witness? No, you don't do any of that. You just say, okay, ma'am or sir, that is your right. The same should be happening with work. It should be just enough to say, I don't want that vaccine. I mean, that really, that should be enough. I don't want that vaccine. That's my right. Because as soon as you offer me a health intervention, I become the patient, and patients have rights to refuse care. But in a work setting, it should be simple as that. But if you want to go the religious route, I could just say, I have a religious conviction that prohibits me from taking that vaccine. And that should be enough. So it's not up to them to validate, but she's going to get into validation in just a moment. Many employers are finding themselves struggling to balance public health and safety with the religious protections provided by the U.S. Constitution. So what's the assumption here? Getting the vaccine promotes public health and safety. Getting the vaccine promotes public health and safety. That's her assumption in this statement. Now, on the one hand, we could say, oh yes, well, we've got 10% or 1/10 the hospital admissions if you're vaccinated, 1/11 the deaths if you're vaccinated. Therefore, it's promoting better public health and safety. However, as many have pointed out, if you are vaccinated, you don't have to worry, right? Because you have better odds. And then let the unvaccinated just, be unvaccinated. To each his own. But anyway, so the assumption is, and this is also a long-term assumption, that public health, and public health encompasses a whole lot more than surviving the COVID disease. There's a whole lot more involved. Okay, so many employers are finding themselves struggling to balance public health and safety with the religious protections provided by the U.S. Constitution. The Constitution is the law of the land. It is objective. It impacts every single person, whereas the fact of the matter is that most people are going to survive COVID whether they get vaccinated or not. Most people are not going to end up in the emergency room with COVID. And certainly a vast majority of people are not going to end up in ICUs, whether they're vaccinated or not. That's just fact. So balancing public health and safety, I have a slim chance, regardless of my vaccination status, of dying from COVID, but I have 100% constitutional protection against forcing mandates upon me. I'm saying that it's not a hard balancing act in this case. So she goes on to say, although individual religious objections range from vaccines use abortive fetal cells, to vaccines interfere in God's plan, it is a well-known fact that there are no major religions with theological objections to vaccines. So if you click on that link, and I advise you to find this article, click on this link online, you will note that what is listed there, for one thing, it says no major religions have theological objections, but I remember there was like one or two that definitely did. So that's that no at the beginning of that statement is not accurate. But also she cites, for example, Baptist. She says the denomination Baptist, or at least this article, Baptist, no objection to exemption or to vaccines. Not considering the fact that there are 56 recognized Baptist denominations in the United States alone, in the United States by itself, not even going into the world. And what they don't understand is that denominational life for a Protestant, especially for a Protestant denomination that recognizes church autonomy, the right of a church to self-govern, we reject denominational authority over our local churches. And so to say that a denomination doesn't have a theological objection to vaccines means nothing to a local church with a Protestant Reformation perspective. Also, and this is where they get this from, they say because statements of faith, like for example, you might have catechisms, or you have the Apostles' Creed, or you have the Westminster Confession, or you use the Second London Baptist Confession of 1689, or you use the Baptist Faith and Message, or you use whatever it might be. There are so many confessional statements over denominations. They'll say because those denominations have those statements, and those statements don't say anything about vaccines, therefore, no major religions have theological objections to vaccines. That's how they're basing it. But that is a false assumption. Why do statements of faith and creeds come about? Because generally they answer questions about who is God? What is the role of the Bible? What is the family structure? Who are the church officers? They don't go into a lot of detail about things like what shall we eat? What kinds of surgeries can we have? What kind of medical care should we have? Now we're starting to see the formation of specialty confessional statements that don't necessarily follow denominations. Like there's one that just came out, and I'm blanking on the name. I might cover it on another video, but it's against medical mandates, basically, but it's not denominational. So anyway, this lady in this particular case is making a statement that's totally not true, and it's invalidated very easily. And she needed to do her homework a little bit more on this one. So then she goes into a couple significant logical fallacies in making her argument in this article. So continue with the article. And directly responding to the COVID-19 pandemic, many major faith leaders have actually encouraged their followers to get a vaccine, including Pope Francis himself. Now this is interesting. Here's this humanist. Generally humanists, what is there's like a slogan of theirs, like ethics without God, or without a God, or something like that. So here they are appealing to an authority in a major religion, perhaps the most well-known authority of any major religion being the Pope, right? They appeal to this religious authority when they don't recognize him as an authority. which is kind of interesting. And so what is that kind of argument called? What is that logical fallacy? That's called argumentum ad verecundium, or argument from authority. And I've covered this in a previous video. Um, and Protestants as a whole would reject that. And I watched a video recently by some Catholic theologians rejecting that the Pope saying something in and of itself about vaccines does not prohibit a Catholic from being exempt from the vaccines themselves. So the other issue is what's called argumentum ad populum, which means that, if the majority of people believe something, therefore it must be true, and that's a logical fallacy. So they're saying she says many major faith leaders. Just because a lot of faith leaders believe that it's okay doesn't make it okay. It doesn't change my belief, my perspective. Okay, let's continue with her article. This means that many who are attempting to utilize religious exemptions provided by the state or employers are most likely anti-vaxxers. Okay, so she's giving this broad generalization. Here's another logical fallacy, gross generalization. So she's saying they're most likely anti-vaxxers or those basing their decisions on poor data. I'm basing my decision on some pretty good data. I've been looking at this data pretty closely. And I know other people like me too, or kind of data nerds, who are like, okay, let's go to the primary sources. And conspiracy theories. Not me. Not me. So anyway, so what's she saying about me? This means that many. Okay, so I'm not one of the many. That's okay. So what they could be is independent religious thinkers who are taking their cues from their scriptures rather than just going with what some faith leader or the general crowd is agreeing to. Okay, let's continue. There would be no issue with religious exemptions if the few taking them were honest about their doctrine, actually rejecting vaccines. And again, she's making assumptions on a false pretense that, especially in the Protestant Reformation mindset, that denominations have a authoritative say in the individual believer's life. So this is a false assumption. So she has a number of logical fallacies going on here. And here's the most egregious thing she says. However, most claiming these exemptions are willing to lie about their faith. Okay, so she's saying at least greater than 50% of people that are filing these religious exemptions are lying. How can she know that? How can she possibly know that? So that's problematic. That's fallacious. And then she says they're lying due to their ignorance about vaccinations. Are we ignorant? I don't think, I've talked to a lot of people. We're not ignorant. Those that remain unvaccinated generally have pretty good rationale. And some of us are better at articulating it than others. So we're not ignorant. In fact, this article has demonstrated a whole lot of ignorance in the argumentation. So, yeah, and what about doctors, nurses, and other healthcare providers? There are quite a substantial minority who have rejected these vaccines. Okay, so what's she say? Due to their ignorance about vaccinations leading to dire health crises. And I've covered in the past that there are some experts that are very concerned that the mass efforts of vaccination for an airborne respiratory-based virus, mass vaccination attempts are actually creating super variants of the virus. In some places like Charlotte, North Carolina, churches have started openly offering religious exemptions for church members who don't want to receive a vaccine. because some employers are requiring proof from a pastor. So yeah, there are some churches where the pastors have said, if you want religious exemption, I will support you on it. That's okay, that's their prerogative. Although legal experts believe these won't hold up in court, the process for accepting religious exemptions differs from state to state and from employer to employer. Or I guess she's saying the letters won't hold up in court. As mentioned earlier, this is new territory for many employers, meaning some will be more that some will be more forgiving than others. And that's true. I've heard stories, at least from individuals, where you've got employers who are able to be talked to through your religious exemption. They say, okay, I can see how you have a valid religious belief system that verifies that you should be exempt. And then there are some who have argued with the person about their faith and trying to invalidate their faith, and you can't do that. Also, the Supreme Court has recently been leaning in favor of religious freedom cases, which could open the doors for many religious objectors, and that's good. We have a First Amendment for a reason. In addition to the debate over the reasoning, okay, and sincerity of those who apply for a religious exemption, so there might be some that are not reasoning well. There might be some that are not sincere, but everybody I've talked to that is working on these religious exemptions has reasoning and is sincere. And so I would say that she's the one raising the concern. So she goes on to say, we must also remember the dangers these exemptions pose to the rest of the community, allowing, okay, I'm sorry, the rest of the community. Okay, that's conjecture, because again, long term, we don't know what the dangers of getting the vaccine are posing. Allowing, that word is very telling. Allowing avoidance of necessary vaccines. So what is she saying? She's advocating for not allowing. She's expecting, mandating forced vaccinations, according to that statement. And what does that say about the right to refuse care, informed consent? I refuse to receive the vaccine. I am well informed, and I've decided not to give my consent to get it. So do we, and also, do we really need the vaccines? Because there is a growing body of evidence about therapeutics. I've talked about ivermectin. It's been panned in the general media, but if you do a little digging, you can find it's well accepted in multiple studies. Okay. Avoidance of necessary vaccines for anything other than a valid health reason puts marginalized communities, especially black and brown populations, at risk. No citation on this particular statement, and it's very racist sounding. So what are you saying? Black and brown people don't have the capability of going to get themselves a vaccine as much as Caucasians? Why? Why are you saying that? It sounds rather racist. These communities not only experience a higher risk for COVID-19 infection. Okay, why do people have more risk for infection? Because of comorbidities. And certain comorbidities such as obesity, diabetes, those are the two, like one of the highest ranking, amongst the highest ranking comorbidities associated with getting COVID. Those do rank higher amongst minorities. And I say this with 30 years of healthcare experience. It's lifestyle choices, oftentimes. Lifestyle. Heart disease, often lifestyle choices. So anyway, yes, they might experience a higher risk, but then they have the ability to go get a vaccine if they want. But in many cases, they also have a harder time accessing COVID-19 vaccines. So again, she cites a New York Times article that you've got to be a subscriber to actually verify. And again, that's not a primary source. So not good research to validate her points. Your argumentation may sound logical on its face. You can make a very logically constructed argument, but if the basis of that argument is false, it might still be logical, but it'll still be a false argument. All right, this is turning out to be a long video. Apologize, but if you've watched this, God love you. Those who are low income, food insecure, and have children at home are even more likely to be unvaccinated because they simply don't have the resources to seek them out. And it could be, and this has been, I think, established that those who are low income, which will make them generally food insecure if they're low income, and generally people that have children at home, especially single mothers, will be food insecure and low income. And anyway, they're all kind of related. They do tend to be less trusting of the government. It doesn't necessarily mean that they won't seek out a vaccine, and the vaccines are free everywhere. They're right around the corner. Those that are low income generally, but not always, tend to live in more urban areas where there's going to be more access to hospitals, clinics, etc., that give out free vaccines. Many don't have the time or opportunity to miss work. I can't tell you how many companies I've heard of having vaccine drives at their work, with like people coming out in like just healthcare clinic vans ready to administer. My brother is with some partners. I mean, their business is pretty decent size and growing, and they've offered clinics right for their employees. Okay, many don't have the opportunity to miss work, to receive a shot, or to recover from side effects. What is that saying? What is that saying? That's saying that there's a good possibility they're going to have some bad side effects from these vaccines. That's a pretty substantial admission that, yeah, they can expect to suffer from the shot. Might miss some work even. Yeah, what does that say about the safety? Refusing to get vaccinated also puts immunocompromised individuals with valid medical exceptions at risk, making it harder and more dangerous for those communities to go back to the school or into the office. Again, this is a problematic statement. It's not validated, and as current research is suggesting, those that are vaccinated can be just as likely spreaders as unvaccinated. So this is not validated. And one potential concern, this is not validated yet, so this is not scientific fact, but one potential concern is that if you are vaccinated and you get COVID, with less symptomology, you will be more likely to just go do things because you don't feel as sick, and you might brush it off like having a little bit of allergies, a little minor stuffed nose, and then you become a spreader. Whereas somebody that's unvaccinated is probably going to get stronger symptoms and be more likely like, yep, I got COVID, and they might sequester themselves. That's just conjecture. That's not backed up by research. But that whole sentence right there is not validated. Many states have been considering doing away with religious exemptions, and we've seen leaders take up this kind of action successfully. Okay, so I mentioned this earlier. Connecticut is the 6th and latest state to get rid of religious exemptions from immunization requirements in schools, with the governor signing it. Although they will be facing legal challenges from opponents, the governor has expressed how important this bill is and the public health impact that it has on our children, families, and communities. And again, assuming that in the long run, the vaccines are going to have net positive effects. When we don't have the long run long-term data to support that. In order to protect those that are already struggling with cancer and other immunocompromising conditions, in order to reduce the risk to marginalized communities with increased risk of the pandemic, in order to prevent the deaths now at several hundred people a day, we must act. We must end religious exemptions. Okay, let's stop there. Everything is not necessarily a valid statement in that, except potentially for in order to prevent the deaths now at several hundred people per day. Chances are, if everybody was vaccinated, we would reduce the death rate short term. Yes, I think that's safe to say. But what she's saying is, because all these things are true, which I believe I've shown that you can argue they're not true, we must end religious exemptions. So she's making a lot of a priori. These are prior assumptions that if they're all true, therefore your conclusion will be true. And I believe that it's not. She says many other states should follow Connecticut's lead if we are to move to more effectively overcome this pandemic. We're never going to overcome it. In fact, it's moved from pandemic to endemic. It's here to stay. The COVID-19 vaccine debate shouldn't be a question of religious freedom, shouldn't it? That's a false statement, as I've talked about, especially when I've made it very clear that her reference to denominational statements of faith doesn't prove anything. But rather, it should be about public health and safety. And it skipped to the next slide. I don't know why it's doing that. But anyway, think of your friends, family, and community. Because if you don't take the vaccine, it's your fault that people are dying. The only way we beat, that's my statement, the only way we beat COVID-19 pandemic is by taking the necessary precautions and trusting in the science. You know, I trust the science too, and the science is just not there to support the long-term safety and effectiveness. The vaccines have been proven effective against fighting this virus. To some extent, yes. And although it is ever changing, the only way we stay ahead of it is by increasing the population of vaccinated people. And that is not a substantiated statement based on long-term evidence. Is not there yet. Now, no discussion about this would be complete without addressing this humanist writing this article from a humanist perspective about why religious exemptions are unethical unless we went to the humanist Bible. And what I've got in front of you right now is what's called the 10 Commitments instead of the 10 Commandments. And you can find these at the website provided right in the middle of that circle. And these are largely recognized by the humanist community. And we're going to look at some of these and see, is she really a humanist? So, for example, the issue of critical thinking. It says, I will practice good judgment by asking questions and thinking for myself. Okay, and this is explained more in detail on their website. It says this, thinking critically allows us to make sense of all this information and reason out our way to good judgments and effective solutions to the problems we face while rigorously avoiding pitfalls like rationalization. So she's rationalizing her opinion a lot. Conformity. So you could say there's some conformity to this general popular view. But here's the big one, though. And stereotyping. Boy, did she do a lot of stereotyping in that article. So she's not necessarily advocating or practicing her critical thinking commitment here. Now let's look on. What else do we got? Empathy. I will consider other people's thoughts, feelings and experiences. Is she really being considerate of those? Is she really looking specifically at why a religious person would be wanting an exemption? And the answer is definitely not. No. What about altruism? I will help others in need without hoping for rewards. Now, that's not as well stated as, let me find altruism in this. Where are you? Altruism is the selfless concern for the welfare of other living beings without expectation of reward, recognition, or return. So is she being selfless in her consideration of the welfare of religious believers? No. And one of the things, besides physical health, we have to consider is mental health. Can you imagine the trauma you would do to the 80 million unvaccinated people if you forced them to get vaccinated? The mental anguish and trauma, some of whom have tremendously strong belief against it. You would do them irreparable damage in some cases, forcing them to get a vaccine. That doesn't sound very altruistic to me. What about humility? I will be aware of my strengths and weaknesses and appreciate the strengths and weaknesses of others. Not seeing that there. So, and frankly, if you're going to take a position on anything, there's going to be a tendency to not be completely humble, like perfectly humble. It's just, if you're going to take a position about something, you are basically saying, I'm right, you're wrong. And, well, that's not going to be entirely a humble position. So now it's time to wrap up, and I'm hoping that when I make this a video, it will be good. There won't be any problems with any of the slides recorded. But I just wanted to go over what can we glean from this article. And I'm going to just read my statements because it's getting late and I'm tired. It does raise some important discussion points. That's clear. That all people who object to taking and refrain from taking vaccinations should be ready to discuss. If you are a conscientious objector for a religious reason, for doing something, anything, you should be ready to discuss that. You should be ready to validate your belief system to some extent. You should be able to reason through it. What else can we glean from this article? It is lacking in much solid evidence to support its claims. Clearly, a lot of secondary, sometimes tertiary references, lacking some data, and really misses the boat on the whole discussion of no denominations support religious exemptions from vaccines, relying too heavily on secondary source material. What else can we glean? It relies on a narrow view of conscientious objectors to COVID vaccinations, so gross generalization of the 80 million people in the United States who have not gotten the vaccine. And it demonstrates that the author is an inconsistent practitioner of humanist values. And frankly, no practitioner of any value system or religion is going to be entirely consistent, to be fair. So while she shows some evidence of like altruism, in one sense, she's missing it in another sense. So she's got a lot of inconsistencies as evidenced in her article. So anyway, I appreciate it. If you've watched this whole video, thank you. I'd appreciate your comments, suggestions. What'd you think of it? Read the article for yourself. See what you come up with. Look at the links that are provided. We need to engage articles like this because when people just give a cursory reading of it without critically thinking through it and investigating it, they'll just accept it en masse and say, you're right, we should eliminate religious exemptions. You made a really good point. They should be eliminated. And that's where the sheeple will follow, and we'll get bad policies, and eventually we lose more and more rights because of that. Anyway, this has been John Adamson, the Rehab and Documentation Guru. I'm ready for bed. God bless you. Have a good night.